James Beck. I'm Professor Emeritus from the Faculty of Medicine of our local university. When I wrote, in order to keep myself limited in time, I wrote down what I was going to say, but I did so thinking I would be addressing mostly counselors. But nevertheless, the message may get through. Some members of council will remember that I spoke in favor of stopping fluoridation before the decision to stop it in 2011. Other jurisdictions have stopped fluoridation and others are considering stopping it. It seems strange to me that this council has been encouraged to restart fluoridation, given that some of the strongest evidence of serious toxicity has been reported since then, and studies of efficacy have only increased the strength of the argument against fluoridation. I was introduced to the question in 1999, and with the advantage of my knowledge of medicine and chemistry, I have doctorates in medicine and in physics. With this background, I undertook the task of evaluating the pertinent scientific literature. I spoke before city councils and committees throughout Canada. I had the privilege of being a co-author of the book, The Case Against Fluoride. I contributed a written commentary in this process. I have found the scientific literature on fluoridation to be a mixture of valid studies clearly reported on the one hand and some shockingly incompetent reports on the other hand. In my written submission, I refer to one from the University of Calgary. That paper is an example of incompetence or dishonesty or both. Unfortunately, it is not alone as such in the literature on fluoridation. Much of the literature slanted to support fluoridation is offered by dentists apparently with little or no knowledge of experimental design or of numerical analysis. In addition to the science of fluoridation, I also learned a lot about some of the promoters of fluoridation and about how governments deal with the question. This learning occurred in several provinces of Canada, but mostly in Alberta. In several cases, I was faced with supposedly specialist physicians working for Alberta Health. All of them claimed, along with their expertise, that fluoridation is safe and effective, but none cited papers on the subject or acknowledged those I offered in evidence. None offered any critique of publications with the exception of some papers on efficacy in preventing cavities, and those comments were unfounded and, in fact, incorrect. In these few minutes, I can only tell you that I found no competently done papers and no other evidence that led me to question my position since our discussions in and before 2011. Since 2011, some studies, well done and described without prejudice, have appeared. Especially important are those demonstrating tragic effects on young children. I am appalled at the recent efforts to restore or restore fluoridation, or to retain it. I have encountered heartbreaking stories about harms almost unquestionably due to fluoridation. I'll give you just one example. After a lecture I gave in Lethbridge, a mother, crying and shattered by guilt, told me of the suffering of her daughter, whom she had encouraged to use fluoridation, with damage to her teeth. She urged me to continue informing people and their city councilors of the dangers of fluoridation.